UC San Diego healthcare, research, and technical professionals march and chant outside the Jacobs Medical Center as part of a statewide strike. AFSCME and UPD labor union members are on the picket line for what they call unfair labor practices.
It's already dangerous. We're already at a point because of this whole unfair labor practice. We're already at a point where people are leaving. They're stressed out. There's a lot more work they have to do, and they're not getting fairly compensated or anything else involved with that.
If we don't stand up for the unfair labor practices, it's just going to continue.
Earlier this month, AFSCME, the union representing about 40,000 University of California workers, filed a complaint with the state alleging UC has, quote, engaged in a coordinated effort to silence and intimidate workers from speaking out about the growing affordability and staff vacancy crises. UC says they have not silenced workers and there is no staffing crisis. UPD member Ruben Barba is a UC San Diego microbiologist. He says UC has increased workloads for employees, but has not increased staffing.
The main issue is that staffing crisis. UC says that we do not have that, but we experience it every day right there in the front lines and in our job.
A spokesperson from the UC Office of the President says they have continuously reached out to the unions in an attempt to settle these contracts. AFSCME member Christopher Kaiser says his pay isn't keeping up with the cost of living.
It's hard. I take care of my mom, who has small cell lung cancer that has relapsed and metastasized to the left side of her lung. This isn't my only job. I have to work other jobs to keep a roof over our head because 72% of my paycheck from the university goes to rent alone.
UPD member Samantha Walsh is a registered dietitian at the UC San Diego Eating Disorder Center.
We have issues of chronic turnover. We've had about a 54% turnover in the last 5 years at UC. So we do not have enough staff to see our patients in a timely fashion. And what that means is the wait times to get seen at our clinics can be really, really long, weeks, if not months.
UC says its data shows staffing is increasing and the number of people leaving is declining or flattening among members of both unions. UC San Diego Health says it has plans in place to minimize patient impact and maintain access to hospitals and clinics during the strike. And all UC San Diego Health facilities are expected to remain open and operational. AFSCME workers are striking through 1 p.m. Thursday, and UPD workers are striking through 1 p.m. Friday. Melissa Mae, KPBS News.